Hi there, welcome to A16Z. I'm here today to talk about the top 2 reasons for shortness of breath when you have asthma. The top 2 reasons are complications from high blood pressure or lung disease. Let's talk about both of those. So if you're new here, we love to make health easy and understandable. So if you like that kind of stuff, make sure you subscribe and leave any comments below with questions you may have. We'll be happy to answer all of them. Let's start with the first reason, which is complications from high blood pressure. High blood pressure makes your heart work harder than it should to pump blood throughout your body. Over time, this extra strain can cause your arteries to become narrower, making it harder for blood to flow through them. This means that your heart has to pump even harder to get the same amount of blood through your body. As a result, people with high blood pressure often experience shortness of breath, especially when they're doing physical activity. In addition, high blood pressure can also cause other problems such as kidney disease, which can further contribute to shortness of breath. When your kidneys aren't working properly, they can't remove excess fluid from your body the way they should. This can lead to fluid buildup in your lungs, making it difficult to breathe. High blood pressure can also cause heart disease, including coronary artery disease and congestive heart failure. Coronary artery disease happens when the arteries that supply blood to your heart become narrowed or blocked. This can reduce the amount of oxygen-rich blood that reaches your heart, leading to chest pain or discomfort called angina. In severe cases, it can even cause a heart attack. Congestive heart failure occurs when your heart can't pump blood effectively enough to meet your body's needs. This can cause a number of symptoms, including shortness of breath, fatigue, and swelling in your legs, ankles, and feet. So how do you know if shortness of breath due to high blood pressure is something you need to be concerned about? Well, it's important to pay attention to your symptoms and see a doctor if you notice that you're having trouble breathing, especially when you're doing physical activity or when you're lying down. Also, keep in mind that high blood pressure is often called the silent killer because it can cause serious damage to your arteries and organs without any noticeable symptoms. Therefore, it's essential to get your blood pressure checked regularly, even if you feel fine. Now, let's talk about the second reason for shortness of breath, which is lung disease. Lung diseases like COPD, pulmonary fibrosis, and asthma cause inflammation and narrowing of the airways in your lungs, making it harder for air to get in and out. This means that you may feel like you're constantly out of breath and unable to get enough air. These conditions can also cause other symptoms like wheezing, coughing, and chest tightness. For example, COPD is a group of lung diseases characterized by inflammation and narrowing of the airways. This makes it hard for air to move in and out of your lungs, which can cause shortness of breath. Pulmonary fibrosis, on the other hand, is a condition where the lung tissue becomes thickened and scarred, making it harder for your lungs to expand and forcing you to breathe faster. Then there's asthma, which is a chronic condition that causes your airways to become inflamed and narrow. This can lead to wheezing, coughing, and difficulty breathing. If you're suffering from shortness of breath due to a lung disease, it's crucial to follow your treatment plan closely and make lifestyle changes to help improve your symptoms. This may include things like avoiding triggers that cause inflammation in your lungs, getting a flu shot every year, and staying active to keep your muscles strong and your lungs healthy. So remember, if you're experiencing shortness of breath, it's essential to seek medical attention to determine the underlying cause. While some causes are more serious than others, there are many things that can be done to manage these conditions and improve your quality of life. Thanks so much for tuning in today. If you like this video, please give it a thumbs up and share with your friends. And don't forget to subscribe. Stay healthy, stay happy.